Good afternoon, and thank you for joining us today. I'm Tracy Seward, the Senior Director for Outreach and Recruitment at the Association of Schools and Programs of Public Health, and I'm going to be the moderator for today's session, Careers in Public Health, How Do You Want to Make Your Impact? I'm very excited to introduce our panelists for today. We have Heather Krasna, Assistant Dean and Director for Career Services at Columbia University Mailman School of Public Health, and Beth Seltzer, Director of Clinical and Scientific Affairs Unit, Bureau of Chronic Disease Prevention and Tobacco Control at the New York City Department of Health and Mental Hygiene. And of course, they are both the authors of 101 Careers in Public Health. So with that, I'm going to turn it over to Heather and Beth.
Thank you so much, Tracy. We're very excited to be here. I'm going to just get our slides here. Hopefully you can see them. Thank you so much for joining us today. I am Heather Krasna, and Assistant Dean of Career Services at Columbia University's Mailman School of Public Health. I've been a higher ed career services professional for 23 years, and I just recently earned a PhD where the dissertation was on the subject of employment outcomes of public health graduates and labor market competition to hire them. And I am joined by the original author of this book, the first two editions, Dr. Beth Seltzer. Would you like to introduce yourself, Beth?
Sure. Hi, everyone, and thank you for being here, and thank you, Heather. So yes, I'm Beth Seltzer. I'm a preventive medicine physician currently working at the New York City Health Department, and they do ask me to say that I don't represent the health department. I'm here as a private citizen who cares about public health. So anything I say comes from me, not from the city. But I'm really excited to share our presentation with you today. And I'll be sharing more about my own career a little bit later. So I'll stop here and hand it back to Heather.
Thanks so much. So today we're going to be talking about different types of careers that are available in public health, and to give you some resources and tips to help you choose a public health career, knowing that actually there's more than 101 in the book and beyond. And so there's probably more than one perfect public health career for you, but we'll talk about resources available and even some career guidance tips. So what is public health? Public health, as you may know, and I'm not sure if everyone here is currently a public health student, there's many different definitions, but one is protecting and improving the health of people and their communities. We can talk about prevention of illness, protection from risk, and promotion of health and wellness and well-being. And my other definition, I like this idea that the radical concept that every person has the right to be healthy. So another way to look at public health is the functions of public health. So these are, this picture is giving a bit of a snapshot of some of the functions of public health departments in particular. And you could see that there's kind of thematic areas, which we'll talk a little bit about. Infectious disease, chronic disease prevention, environmental health, maternal, child, and family health, and then many of the functions that might be kind of behind the scenes, keeping your programs running, such as organizational training and development, and building community partnerships, and assessing whether your programs work, and things that kind of cut across all areas. So who does all this public health work? I'll do a quick overview. And certainly you've probably heard of some of these agencies. The federal government does a lot of public health work. The CDC is one of the most important of the public health agencies, and there's many other agencies that are part of the US Department of Health and Human Services, such as NIH and US Public Health Service and so on. Then there's an FDA. Then there's some other agencies in the federal government that do public health related work, like the EPA and USAID, which does global health work. A lot of public health happens at the state and local level. So you have your state health department, state government health department. You have the core heart and soul of public health, the local health departments. that do work for cities, for counties, for tribal governments also. And there are healthcare systems and hospitals that contribute to research and that do public health work and also have patient safety, which is part of public health. And you have international organizations, NGOs, international non-governmental organizations, UN agencies, community-based nonprofits and nonprofit organizations, and then just a whole plethora of other organizations that contribute in one way or another to public health. And those can include tech startup companies, marketing companies, consulting companies, and so on. So we have taken some time to look at the different careers in public health. And you can see here that there's a really broad range of these, including some where you may not need to get a bachelor's degree, and ranging all the way to ones where you need to have a PhD, a DRPH, an MD. There's opportunities for dentists and pharmacists, and it goes on and on. Laboratory scientists. So we're going to take a bit of time and start to look at different public health careers. And you can see there's really something for everyone. There's certain kinds of careers that really only exist in public health, and there are many others that you could do in public health organizations, and you could do those similar jobs in many other organizations. And we'll be just kind of highlighting a few of these unique and interesting opportunities. And before we do that, Dr. Seltzer will talk a little bit about her own experience in public health.
Sure. So Heather and I like to share my story partly because when I was in my public health training, a lot of my fellow students, we knew we wanted to go into public health, but a lot of people had the feeling of, what am I going to choose? And oh my goodness, what if I choose wrong? It's such a huge field. There's so many opportunities. I want to do it all. I don't know exactly what I want to do. So I'm here to tell you a little bit about my own career, to share that, first of all, don't worry, you will find your way. One of the cool things about public health is that the skills you develop will serve you in many, many different areas of the field. And people do make lateral moves. They do sometimes change subject areas. Sometimes they change the focus of what they do. So don't panic. This is my chance to say it's going to be okay. So here very quickly is my story. I started out 30 years ago now as a documentary filmmaker. I had no intention of going into medicine, no intention of going into public health. But as I did this work, which often had to do with social issues, more and more I wanted to be the one making a difference, not just the one recording it. And so I thought, what do I want to do? And I decided to go to medical school. And while I was in medical school, I came face to face with the many difficulties and problems in our healthcare system. And I decided, I don't know if I just want to be a practicing physician. I want to be part of making the system better. And that's how I found my way into public health. I was lucky enough to have a mentor who said, you need to go into preventive medicine, which for anyone who doesn't know is the public health medical specialty. And so I got myself into a public health preventive medicine residency. And then here's how we go into the many different things you can do. My advisor at the time heard about an opportunity at the Discovery Channel. They were looking for someone to do a residency rotation on a show that was concerned with physician education. We would teach about medical topics, and doctors could get their continuing education credits. And I thought that was great opportunity to improve the capabilities of our healthcare providers. And so I jumped into this residency rotation for 6 weeks. And about 4 years later, after I'd been invited to join the team as an ongoing writer, so I spent about 4 years doing that, got to produce documentary style shows, or help produce documentary style shows, helped to write all kinds of informational shows. And eventually I realized I didn't really want to be in that space so much anymore. It was time to step back out of media. And I got interested in lifestyle medicine. And through going to a conference and meeting some folks, I was offered an opportunity to work for the Makah tribe out in Western Washington as their public health physician, and also doing primary care a few days a week. And I went out there on a 1-year contract, excited to have this opportunity. And 6 years later, I had been the public health physician for a town of 1,500 people. I had dealt with fires and disease outbreaks and water contamination and all kinds of other things that come up. I had gotten great experience as a family doctor. And when it was time, and the next bullet point, I had gotten experience helping to run our wellness center, which dealt with a lot of aspects of lifestyle medicine. And when it was time to come back east, I was lucky enough to get my current opportunity here at the health department, where I get to oversee our cancer prevention program, our public health detailing program, which is physician education, and a hypertension initiative, which is trying to address blood pressure all across the city. So that's my example of how you will find your way. I love my job. And now I'm going to tell you about some other jobs that some really amazing people have. Next slide, Heather. Great. So this is your classic public health job. And what Heather and I did here is picked some roles. We wanted to make sure we had some roles here at all different levels. An epidemiologist is one of those roles that you can do at many levels. You can start working in this field even before you have an MPH. There are MPH level jobs, PhD level jobs, DRPH level jobs. But fundamentally, the epidemiologists are the disease detectives. These are the people studying how diseases spread and how to stop them. And Caitlin Wolf, who's quoted here, is one of our interviewees. And when we talked to her, she was doing really neat COVID-19 work with internally displaced persons camps. And so she was helping to look at how does a disease like COVID-19 spread in these close quarters camps. She was doing rumor tracking. What kinds of stories are people hearing about COVID and how is that impacting their ability to protect themselves and cope? And she was doing contact tracing. And I don't think at this point I have to explain what contact tracing is to anyone. In a previous edition of the book, we had a totally different epidemiologist role, Arizona State epidemiologist who was looking at our more typical diseases that don't respect borders. So what's happening in Mexico, what's happening in Arizona, what's happening in surrounding states, and they would keep track of these diseases so that if something was starting to spread, they could jump into action to control it. Next slide.
So actually, before we go on, there's actually a really pertinent question in the chat, which is relevant, which is someone who's interested in cancer epidemiology and how can I work in cancer epidemiology, which institutes are really great to work with. And so I just want to take since that's really about this exact slide, I thought maybe we could touch on the idea that there's 100 flavors of epidemiology, right? You may think of the infectious disease epidemiologist as your classic person who's doing this work, but there's cancer epidemiology, psychiatric epidemiology, pharmacoepidemiology, and absolutely there's cancer epidemiology, and there are all sorts of there's a lot of research that goes on in academic medical centers. There's also National Cancer Institute, which I believe is part of the NIH, National Institutes of Health. There's certain cancer research fellowships that I've seen that are housed at different universities. So there's sort of a lot of possible directions you can go in, and you can also be trained as an epidemiologist and then go on to do, there's like a whole host of things you could do with that training. The classic thing being to be an epidemiologist, but you can also become a data analyst in a bunch of other ways, and the skills are very translatable. I just wanted to jump in with that, and I don't know if you want to add anything back about the many, many kinds of epidemiologists that are out there.
Yes. And the specific cancer question, I think the person was anonymous. If you want to send us your name, I'll try to follow up with you, and I can share some of the places that we work with just to give you some ideas.
Great, thank you.
And I see someone else asking what type of epi jobs you could get without an MPH. Usually to be an epidemiologist, you need at least that MPH or a degree in epidemiology. So it's going to be more like the helper jobs. Heather, do you have any other insight on that?
So That's right. I mean, in most cases, the vast majority of the time, you would need to get a Master of Public Health in epidemiology specifically, or something very similar. But you're exactly right that there are all kinds of other jobs where you might be doing things that contribute to what's called field epidemiology, where you might be going out and investigating when there's some sort of outbreak of some kind, and maybe gathering data or even interviewing people to get that kind of information about what's going on with some outbreaks. That's a possibility. Contact tracer is also related. It's a little bit more about disease intervention and prevention, but it's also about kind of keeping track of data. So there's a whole range of things. There's even something I've seen called a nurse epidemiologist. I'm not exactly sure what the requirements are, but there's a range of possibilities. But classically, to actually have that title of epidemiologist, you would usually need a master's degree, and many people also have a PhD or potentially DRPH with a focus on epidemiology. So, but again, many careers don't require that master's level. So we'll be talking about some of those also.
And I see we have a ton of other questions. We're going to hold them for the Q&A section, and hopefully we'll be able to answer some of them. But I want to make sure we share some of these other jobs because I just think they're great and I think folks should know about them. So here's another one. This is William Moore, who's another of our interviewees, and his actual title is a perinatal educator. And he is focused on the maternal mortality gap, the inequities in maternal mortality, and also infant mortality. And this is data from his county, Black women dying at a rate of 243% more than white women. And I can tell you we have a similar problem here in New York City. And there was just a press release recently about a program that our health department is doing that is trying to get at the same problem and in some of the same ways. So William Moore, he teaches home visiting nurses who visit pregnant people and new families. He teaches them how to understand people's culture more and pay more attention to the kind of the holistic sense of what people need. And he teaches pregnant people and their families about health during pregnancy and what to watch for. He teaches about taking care of a new baby. And one of the coolest things he does is, I think one of the coolest things he does is teach classes for men. And he shared with us that at least in the groups that he works with, a lot of men, and especially men of color, have been through trauma. And he described that a lot of the men he works with have kind of a fight or flight response to difficulty, and it makes it hard for them to be good partners and good dads. And sometimes what pregnant women really need is a partner who can advocate for her in the medical setting to make sure that everything she needs is taken care of. And a man who can help take care of the baby so that mom and baby can stay safe. And even that men can recognize postpartum depression in their partners or even in themselves. And so he's giving people these skills to try to tackle this problem of inequities in maternal mortality. So love William Moore. I just think he's doing great work. And this is a career in public health. Now, William has a bachelor's degree and a certificate in perinatal education. So that's his training. And some other folks in his world have MPHs, but some don't. So next slide. All right, this is another one. I love them all. Sorry, I'll stop saying it. This is another really great one, though, in our efforts to address the need for equity in public health. Maureen works for Marin County, and the story that she told us, her work is to go out in the community, listen to the community, and bring what they say back to the people who design the public health programs. And she told us that there had been an effort to create an equity plan for Marin County, but they didn't do a good job of talking to the community. And so the plan didn't work. And so she is now, well, at the time we were talking to her, she was focusing on really listening, pulling together a community advisory board that was really representative of the community and paying people for their time, not expecting people to just show up and volunteer when we get paid for our work. So a community engagement manager is very much a thing in many areas of public health. I have a program in my own unit where we're trying to do more of this, listen better, listen harder, listen more effectively. Maureen actually has an MBA. You'll see people in this role from PhDs with bachelor's degrees, with all kinds of backgrounds. You just have to be aware, culturally aware, and be able to connect in with the community. Next slide. And oh, Heather, you're going to take this one.
Yeah. So definitely another role that people are not always aware of, or they haven't thought very much about it, is environmental health. And there's many types of careers in environmental health, and there's actually a chapter of our book about that. And one of these roles is actually one of the oldest careers in the public health field. It's at least 100 years old, actually, this particular occupation, and yet many people have never heard of it. And so this is a role where you would be going out into the community, into organizations that are serving the public, such as restaurants and daycare centers and swimming pools and places of that nature, where you would be inspecting those places to make sure that they're keeping their facilities clean and sanitary, and that there's no pollution or infectious diseases or other kinds of problems that could cause people to get sick from using those facilities. So just an example, a classic example is someone who's a restaurant inspector who goes out to make sure that there's food protection protocols being used. And so the person we interviewed for this book, who is a sanitarian, is doing a slightly different version of that work. And she's going out into apartments and neighborhoods in New York City that have a rodent problem, which I hate to say, living in New York, you occasionally run into this kind of issue. And the funny thing about her is that she has a bachelor's degree, and her master's training is in biology. And she found that actually the population ecology training that she got in biology was really relevant to this work as a sanitarian. And now she supervises people where there's a problem. And she also trains people in the community about how to keep everything clean so that we don't have a rodent issue. She finds the work very meaningful because she's working with people who are in a really tough and kind of unpleasant situation. And she helps to make sure that their living situation is better and keep the city healthy and clean and avoiding these pesky rodents. So, not every environmental health job is like this. This is a very hands-on example, I would say, not for everyone, but she's doing some really incredible work. Now, another person we interviewed for the book is more someone managing a program. She's an HIV Prevention Strategist. That's the title. And this is someone who, Mariah Wilberg, who we interviewed for the book. She is herself someone who is open that she's HIV positive. And from her lived experience, she has that expertise of building a program that serves individuals who are HIV positive. And there is a national investment called Ending the HIV Epidemic, which she is working on to implement the program, to build connections with people. And she actually has not an MPH, but an MPA. And she shared that people with public health degrees, social work degrees, and public administration degrees are actually all common in this type of work that she's doing. And she's working on building a strategic plan to end the HIV epidemic. And you can kind of get a sense of some of the planning that she's doing, the targets that she's aiming for. And so you focus on prevention, treatment, and responding to and diagnosing people so that they are able to get the treatment that they need. And, again, you'd be working with community members, with stakeholders, people at different agencies and organizations, advising people at conferences and in leadership roles. So that's just a quick snapshot of another public health career. Beth, you want to go ahead?
Sure. So I asked to talk about program evaluators. This is really an incredibly important piece of making sure that we're doing what we said we were going to do and accomplishing what we meant to accomplish. It used to be that evaluation would be kind of left out of programs. There wasn't always money to do it. There wasn't always focus on doing it. And more, when you get a public health grant or a contract, the requirement that you do evaluation is going to be built in. And so I will tell you, we could use some more evaluators where I'm at right now. So this is definitely a job that should be out there if you're interested. The person we interviewed for the book for this one is Casey Lyons, who at the time was working for the Southern Plains Tribal Health Board. And Casey was helping to evaluate a program with peer counselors in an opioid treatment program. So what's an evaluator going to do in a setting like that? Ideally, you're going to be around at the beginning when the program is being conceived. What are our goals and how are we going to figure out if we met them? Is it enough to say that, oh, well, we hired a dozen peer counselors? No, we really need to know what they did. Did people get better? What were they telling the people? What were they teaching? How did the people think about the care they were receiving? So step one, figure out your goals and then figure out how you're going to measure them. And then during the program, the evaluator is helping to make sure that the right kind of data is being collected and that it's actually being put into the spreadsheets or however else it's going to be collected. And as a program goes along, often the evaluator is going to do spot checks along the way. How are we doing? Do we need to change anything? Are we sticking to what we said we were going to do, or have we gotten off the path? And if a program finishes, if it had a set amount of time, at the end, the evaluator is going to say, how did we do? And ideally, they're working closely with the team all along to keep an eye on things and really help keep us on track and help us see, did we do it right or do we need to do it differently next time? Casey has an MPH, and that's a pretty common level to be an evaluator. I've also worked with evaluators who had PhDs, and that would often be a more of a leadership role, working more independently. Yeah. So next slide, we have one more job, emergency preparedness. This one has been such a huge part of my life for the past 2 years. And I will say, even if emergency preparedness is not your interest and specialty, if you go into public health, especially with a government agency, it is part of your job. So when something goes wrong, we all get called in to help. And in fact, when Heather and I were working on this edition, would you say most people told us about their COVID work in addition to their regular work, Heather? Yeah.
Yeah, almost everyone we interviewed. It's amazing that anyone talked to us because we were writing this book right in the middle of the first year of the pandemic. And there were almost everyone had been called up basically to stop whatever other projects they were, not to stop, but like to add on to whatever other project they were doing to try to deal with the COVID pandemic. So yeah, everyone could be called up kind of on an emergency basis.
Yep. And it was part of my job too when I was a small town public health physician. If there's an outbreak, if there's an outbreak in the next town and you have to get ready just in case. So it becomes part of all of our jobs. But there's also a very specific role for the emergency preparedness folks. And so Megan McGinty, who we interviewed, told us about working in emergency preparedness for New York City Health and Hospitals, which is our big city-run healthcare system. And what Megan was doing was helping to create the plans. So in calm times, when there's not an emergency, they're making the plans. They're figuring out, what are we going to do if a disaster happens? And they try to plan for all kinds of disasters and figure out how, like, what's going to happen that's kind of the same in all the disasters. So they call it all hazards planning, and also specific things that might come up. So for example, we talk around here a lot about coastal storms when we're not talking about COVID. So you might say, all right, if we had a big storm, the hospital might flood, the power might go out. What are we going to do if public transportation breaks down and nobody can get to work? And so they make those plans. They work with different departments, different experts to make sure that they're practical and realistic. They make sure that everybody's up on what would happen if something went wrong. And then when something does go wrong, like a global pandemic, they swing into action and they carry out the plans. They make sure that everyone in the organization is aware of what's going on and what's expected of them. And they get ready to basically turn on a dime if they have to. And we learned a lot as we went with COVID, devised new systems, came up with new processes. And as the emergency preparedness person, your role would be to make sure that all that happened well. You have to be flexible to do this job. Megan shared that they take turns being on call 24/7 when the emergency happens. You might be at the office at 11 o'clock, 12 o'clock at night. So this is a good job for a person who likes that kind of role. And there are all different levels in this job too. There are people, probably bachelor's all the way up in this role, and you can see Megan with PhD, MPH, and MBA. Oh, I see someone as asking a question about salaries. We do have salaries quite a bit in the book. We tried to pull a range of salaries for every job we talk about. And I'll add here that this is a tiny sampling. We wanted to share just some of the really neat opportunities in public health. There really are over 101 in the book, and we didn't even get to them all. So salary information is there. And if someone has a specific question, same as I said before, send us, give us your name and we'll try to get you the info.
Great. So we have a whole bunch of questions in the chat, and we can pause just for a bit and touch on a couple of them, if that's okay. And then we can go on into the next section, which might actually answer some of the questions that people have. So there's certain questions about credentialing. So there's a question about, if I have an MPH, would it be helpful to be CHES certified? CHES is Certified Health Education Specialist. So usually you see that when someone is doing a Master of Public Health with a focus on health behavior or health communications or health education and promotion or something of that nature. I think it could be intriguing to see whether that could be combined with other kinds of skills. The person was asking, like, if you maybe you're studying epidemiology, but then you also want to get your CHES certification. It's not a combo that I've seen a whole lot, but the thing about intriguing combinations like this is that when you have two different types of skill sets, then it's like I'm going to show a Venn diagram in a minute, but basically it's a Venn diagram where you get to be either a health educator, or you could be an epidemiology person, or you could see where there might be some kind of overlap, which I'm going to make up, just guessing that, like, evaluating the impact of health education programs using the data science, data analytics kind of skills you have from epidemiology might maybe combine these two things. So it's a bit of an unusual combo, but not unheard of. And similarly, someone else was asking about combining environmental health with data analytics. Well, definitely there's some room for that. There's environmental health research, and I'm thinking of some of the genius level faculty at Columbia School of Public Health that I know work in the environmental health science department, but they have incredible data science, data analytics kinds of skills, like, so I could see that kind of role fitting in academia, but I could see that certainly also potentially being in a health department or a big, the CDC. There might be research institutes that combine these kinds of skills. You could even work in for-profit companies potentially, possibly thinking of toxicologists maybe could combine these kinds of skills together somehow. I don't know if you want to add anything to this kind of these combining of things together. I see like a couple of questions like that.
Yes, I was just thinking as I was listening to you, Heather, really, about my own career and how all those things that I shared here about my own history, I use all those skills that I gained along the way just about every single day. I use my media skills, I use my family practice skills, I use them all. And so I think that's something important to realize about public health is there are jobs that overlap. There are jobs that let you If you are a person who really enjoys crunching numbers and you like statistical analysis, you can do that in the environmental health space. You can do that in the cancer space. If you're a person who loves going out in the community and talking to people in the community and bringing their messages back to the people in power, you can do that in all different kinds of spaces. We're going to be doing it in the hypertension space, but you could do it in injury prevention. There are just so many different ways you can use these skills. One of the things I did for the very first edition of the book back in 2010 is I just went online and I started looking at the public health job boards, and I started looking at all the different things that were available. And I would recommend doing that if you're really trying to get a sense. Poke around, look around. And Heather's going to talk a little bit about different resources, but I know, Heather, that you're a fan of LinkedIn, of finding someone who does the job you're interested in and asking them about it.
Exactly. Yeah, so actually, I think this is a nice segue to get into, like, how do you then choose your career, and then and how do we maybe use your interests and skills to make a decision. So in terms of resources that you can use to explore different public health careers, you know, the book we have is a good starting point. You can get it at the library. There's also a discount that you can get using this discount code. And it really goes into so much detail. It has an overview of what public health is. And then there's a chapter which is really about career decision making. And I'm going to talk in more detail about that in the next couple of slides. How do you figure out what's right for you? And there's a career assessment tool, which I'm actually going to show you in a bit, where you can figure out your interests and then how they might match up to different kinds of public health careers. Then we talk about what kind of education you may need. So I saw questions in the chat about, should I really get an MPH? What about a bachelor's degree in public health? What can I do with the DRPH, and so on? And you'll see that, you know, like, there are certain roles where you definitely would need to get a master's degree because it's a requirement for the jobs. And then there's many where a bachelor's degree is completely great, bachelor's plus some experience, some training, even associate's degree with some experience. You can get that experience in different ways. So it really, really depends on what you're aiming to do and what role you want to play. And then the bulk of the book is in detail about each of these different career paths. So there's profiles and descriptions of, you know, what are the skills you need to be, you know, a health economist, and where would you potentially find a job as a health economist, and how much money would you potentially earn, and is there a growth in hiring for this role? And then, of course, resources and professional societies. And then we have all these interviews, which we showed a few of earlier. And then, of course, tips on actually how do you find these jobs. So I'm going to give a kind of inside scoop here of something that's in the book, but it's not actually imaged in the same way. So this is sort of a unique thing that, you know, just participants of today are going to get. So this is extra bonus. There's a career assessment that you can take. It's very, very simple. It's takes about 10 or 15 minutes. And if you're really not sure exactly what you want to do with your career, you can try it. It's this mynextmove.org website, and it's called your career interest profile. And this is based on a career theory where, you know, basically every person has a set of different interests, and they tend to kind of, most people will take this assessment, it'll say, you know, your top 3 interests, like your investigative and then social and then realistic or whatever. So these are basically just sort of broad categories of jobs. And what we've gone ahead and done is taken the jobs in the book and looked up what career interests they kind of match to. So if you say, you know, I really like hands-on physical work, that's realistic. You like, you know, fixing things, you know, using tools, things like that. There's roles in public health as like a food inspector or lab technician, which are very hands-on jobs that would be great for you. You'll see there's a whole bunch of jobs in public health which are called investigative, which is basically roles where you're doing some kind of research, you're gathering information and making meaning of it. And so you'll see that a lot of the jobs we've talked about require you have to be a curious mind and want to continue gathering data and knowledge. You have jobs for creative people and artistic people, people who like expressing themselves. There's writing, there's also, you know, visual communication and design that could be part of health communication, things like that. Social would be people that are helping professionals, people that like listening to others, who like guiding others, who like talking to people. They kind of sometimes are what I call a professional extrovert, like their job is to go out and make new contacts. So the community engagement person or the health educator would be a social profession, a helping profession. And of course, there's a ton of those in public health. Enterprising is more managerial and supervising and making sure things get done. So persuading people, you're still working with people, but it's more around management and business and project management, or also persuasion like advocacy. And then finally, there are jobs in public health which have to do with making sure that things are done properly and correctly and according to all the rules and regulations, and that everything is in an orderly place. And that would be the conventional, the role of, you know, regulatory affairs or coordinating of studies. It's a lot of kind of making sure the details are adhered to. So this is just a quick snapshot of some of the different kinds of roles you could have according to your career interests. And then once you know this, you can put it together into this little Venn diagram idea. And this basically is just showing that in public health, like in most fields, there's several different ingredients that make up a career. One of them is mission. So some folks in the chat have said, you know, I'm interested in cancer epidemiology, or I'm interested in food insecurity and making sure people have access to healthy food, or maternal child health, or even global health. I really am interested in international work, or there's a certain country that I really want to work in. That would be, I would call the mission area. The second is, and so that's like, what is the topic or subject that you're going to work on? And some people are very passionately driven in public health to work on a specific mission. In fact, that's a lot of why some people join public health, is that they want to fix a problem or challenge and make the world healthier in some specific way. The second bubble there on the right is, what are you actually doing? Are you using you know, communication skills? Are you talking to people? That's where that interest assessment that I just showed you would fit in. Do you like doing research? Do you like, you know, going out into the community and talking to people? Do you like program planning and so forth? So you can combine these things together and see what combinations you get. Now, the third one that you want to consider, the third factor, is lifestyle and values, which is how much money am I going to make? What's the work-life balance like? Are there jobs in my geographic location of interest? So of course, in your ideal world, you would get the intersection of all these things. You would get to be that, you know, a nutrition epidemiologist who studies food deserts in rural areas of upstate New York, right? Like that's a job that someone probably may have. I don't know, but that's a way that you can combine these things together. And sometimes you may have to, especially at first, when you're just launching your career, maybe 2 out of 3 isn't so bad. If you can get, you know, you have to decide for yourself, what is your deal breaker? What is it that you will absolutely, you cannot accept a job if it pays below a specific amount that you need, or you're only going to look in a certain geographic area, or you know what, you love doing the epidemiology work and you can compromise on the mission. It's okay if you're working on a range of different kinds of issues, as long as you get to code in SAS or whatever, right? So that's what you might have to prioritize. And in terms of, you know, once you have this Venn diagram figured out, you've done some self-assessments, then you have to start thinking about how you're going to get that job. You would want to do that first step we just talked about, figuring out your priorities. Then researching careers. And Beth is right. I love LinkedIn for that as a research tool. There's many other research tools out there. There's actually a YouTube channel, which is at the end of this, where we can send to people actually, that has videos of a day in the life of all these different careers that we've put together. It's like, you know, playlists. Chapter 4, infectious disease careers, day in the life of an infection preventionist, or so and so on. Once you have a bit more sense of what you want to do, you have to start to build some experience that you can get either through internships or volunteering or part-time jobs or student leadership. other ways that you can boost your experience, and work on your resume and your cover letter. Get that in shape. You want to tailor it to your target audience. Make sure you're using the buzzwords from the jobs that you're really excited about, that you are showing your enthusiasm and your interest in the mission. You want to build connections with people. Any decent career counselor will tell you you have to do some networking. Not everybody likes the idea, but if you think about it, you're just sharing your passion with other people who share the same passion, right? Like everyone you're talking to is someone who has a really cool job in public health. And what could be better than asking that person about their career? And guess what? If you're a student, people love talking to students. I just have to say that you should play that up. If you're a student and you say to somebody, I'm a first year public health student studying health behavior, and I really admire your career as a health educator. Would you please be willing to give me just a few minutes of your time, because I'd love to get any guidance and wisdom from you? Who could possibly say no to that, especially someone in public health who loves their career, right? People love helping out students. And so just play that up if you have that as your calling card. You then have to implement. You got to go out and actually apply, go out and hopefully get some interviews. If you're lucky, you get an offer, and then negotiating the offer. Yes, you can negotiate your offer. Of course, it depends on exactly what the role is and your personal situation, but people do get the ability to negotiate a higher salary within public health, just like anything else. And of course, if you're a student and have access to career services, I can't reiterate this enough, and I'm kind of biased because I've been doing this for 23 years, but use your career service office. They're there to help you. That's their whole job, is to help you figure this out, because this is a lot. This might be overwhelming. Here I'm giving you a list of, feels like 200 different things you have to now do. Take one little bit at a time and make sure you use the resources available. A couple more tips. There's some websites that actually haven't even launched yet, but I would say bookmark these. You can sign up on these websites to get an alert when these become available. So we're working on a website to help with career guidance for public health students. So that's the Individual Development Plan website. Hasn't even launched yet, but you can take a look. And there's also another website that is hopefully going to launch in the next couple of months, which is a guidance website for careers in governmental public health, which you should be aware of. A couple more quick things, and I want to make sure we have time for questions, so I'll zoom through these and just know that the recording will be available afterwards. We're glad to send these slides out if you have a question afterwards. So if you are worrying about student loans, I just want to point out that there's several different things to know, that if you're working on choosing a degree in public health that or in other related fields, there are some loan repayment and loan forgiveness options. So everyone should be eligible for public service loan forgiveness. If you work at a nonprofit or government agency for a period of time and you still have loans after that time period, then they will be forgiven. And that's a really good thing just to keep in your mind. There's some other programs that are very specific for certain occupations, and some of those do apply for people working in certain situations like governmental public health departments. You may be eligible for other loan repayment programs. There's also some exciting news, because I would say this is a good job market for public health grads, but for some really tragic reasons, which is because of COVID. There's realization we need to invest in our public health system. And so there is some money that is going out to hire people. And so there's actually some really good new opportunities that are about to launch. So Public Health AmeriCorps. This is especially great if you're maybe a career changer or a new college grad and want to just get your very first experience. This is an excellent program, and it has really great training, and it will give people experience in public health. There's other programs such as the Association of Public Health Labs. If you're a science major, or also that it also includes many public health disciplines, epidemiology is in here, environmental health is in here. This is a hugely growing area because we've seen that our public health labs need some investment. We need to be able to test and keep track of all the weird new variants that are coming along and things like that. So there's all these new programs, so you can look up the Association for Public Health Labs fellowships. Then there's fellowships at the CDC. There's some that are for more entry level, bachelor's, master's level, and there's also some pretty neat ones for doctoral level or for medical, students. And so just some tips to close our presentation, then we'll try to get into as many questions as we can. Again, use your career center. There's other websites. There's a lot listed in the book as well. Publichealthjobs.org is a really nice one. It's specific for public health. There's other special programs. If you are a public health student right now, ASPPH has fellowship programs. And just know that this is such an important field. And if you're passionate about helping your community and preventing illness and promoting health and wellness and giving everyone a chance to be healthy, then now is a great time to join this field. And there's really something for everybody. So we have about 100, we have 34 questions. So I don't know if we'll get to all of those, but I don't know if Tracy, you want to come in and feed us a few questions.
No, thank you. This was fantastic. So one of the question themes I saw was that people are looking for where to find jobs. I know you just mentioned public health jobs, but specifically if you were looking for internships, do you have any good resources for where to find like these opportunities to engage?
I can jump in, and then Beth, if you want to add something. I mean,
Sure.
Yeah, there's many different ways to find an internship. I would always start out with your school. If your school has an internship program or internship coordinator or anything, then that person hopefully has sort of a list of possibilities. There's actually some internship programs listed in the book in the last chapter, and a couple of other chapters it's mentioned pathways that you can get in as an intern. There's other just broad-based websites, believe it or not, websites like Indeed.com. You just have to use the correct combination of buzzwords. So you might want to do like open quotation marks, public health, close quotation marks to get that exact phrase, and then add the word intern or internship. You can actually get a lot of options from that. I think it's actually kind of awesome to be really proactive sometimes. So if you're one of those people that's super mission oriented and you have always dreamed of working for a specific organization, sometimes organizations, especially a smaller organization like small nonprofits, they may or may not even have a structured internship program. But I'll just take a second and tell you my own story. 100 years ago, when I was in graduate school for the very first time, I had to do an internship for my master's degree, and I knew exactly which organizations I wanted to work for. So I cold called one of them, which sounds bizarre, but I actually used the telephone because that's what we did back then. And I called and I was incredibly nervous. I felt totally awkward. I did it anyway. And I said, I'm sure I sounded really, really, really silly, but I said, I'm getting my master's degree in nonprofit management at the time, and I'm really interested in the mission of XYZ organization. And, I have to do an internship for this degree. I'm just curious if you've ever had any interns. And they said, can you come in tomorrow for an interview? We actually don't even have our internship posted, but we really need somebody with your background to come in. And I had an internship for a whole year, exactly in the field I was interested in. So it's not at all impossible to do something really proactive. Beth, do you want to add?
I will definitely second taking opportunities. It's really the networking piece. Taking opportunities to see if you can find and connect with the people who do the work that you're interested in doing, because yes, go to the official internship places, and we encourage you to use the library if you want to take a look at the book, but use those official ways to, official structured internship programs, but also ask around. Go to your local public health association meeting if you have one. If you can make it to the American Public Health Association meeting, go talk to people. Because sometimes, yes, either the internship is not advertised or it doesn't exist until you ask. One other website, Heather, do your students have much luck with Idealist? I always think of that.
Oh, I love Idealist.
Public health opportunities.
Yeah, idealist.org is phenomenally wonderful. It's basically almost all nonprofit opportunities. That's a fabulous place to look. There's sometimes also government specific websites like USA Jobs for federal government. You might be able to find things in there. but sometimes even those opportunities are just posted on the agency website specifically. And the same thing for like state and local health departments. You'll have to kind of sometimes dig down to find those. But there's some spectacular internships out there. Yeah, I do love idealist.org as a site for sure. I'm a fan.
Thank you. There's a lot of questions of trying to figure out what degree path would make the most sense for them. So maybe could you talk a little bit broadly about the kinds of jobs that bachelor's, master's, and doctoral students might be looking for?
Do you want me to
Heather,
take
do you
that?
want to start or do you want me to
Sure.
start?
Yeah, sure. So, there's definitely a lot of opportunities at the bachelor's level or even associate's level. I would say that those opportunities may be more, there's classic one that comes to mind is community health worker. And that's a really important backbone role in public health. And it's working with communities and connecting them to resources at the health departments and engaging people to develop solutions to challenges that are in their community, especially. There are these roles that are a little more, again, kind of hands-on. I would say the sanitarian job, you may be able to do just with your bachelor's degree, depending on the role. There's lab technician jobs in the public health labs, especially, that wouldn't necessarily require any, higher degree in particular. Some of the jobs like food inspection, those jobs especially too, I don't think require the degree, a higher degree. As you move into things where there's more specialized knowledge or credentials required, for sure, like epidemiologist is one where you would need a master's degree usually. The roles that require really specialized training, I would say, or sometimes leadership roles, certain jobs you have to have a PhD, for example. So university faculty, you need to have a PhD. If you want to be the senior researcher, the principal investigator on a grant, usually you have to have a doctoral degree. It may not be a PhD, it actually might be a DRPH or another degree, but and then ones where you need a credential, like some roles you need to be certified or licensed. So like public health nurses need a nurse, you have to be a registered nurse, right? Some roles are like that. Public health dentist and so forth. I don't know if you want to add that. There's so many opportunities though.
Yeah, sure. One we don't talk about so much are the non-public health degree jobs, like this water and sanitation. Some of that will be an MPH type of training, and some of that you need an engineering degree. There are city planners who focus on public health, walkable cities, environmental justice. But thinking about kind of the School of Public Health line of opportunity and degrees, the other thing I would just add is one of the things we see here at the health department is folks will start out at a bachelor's level at a kind of beginner level. It's a lower paid job. It's more of a helper job. Some of the going out in the community jobs are the bachelor's level jobs. And those of us who are stuck at our desks are higher level jobs. But sometimes you can start out with a bachelor's degree in those kind of entry level places, helping a program. And then as you figure out what you really want to do and what you really love, we see a lot of people go back and get their MPHs. And then we see them go back and get their DRPHs. So some look around for entry level things if you're interested in starting with a bachelor's.
That's awesome. So I don't know if we have time for one more question. I know we do we're out of kind of running slow, but if you want it quickly, because you're talking about the intersection of public health, there's a bunch of questions in here about intersections of all the different ways you can engage in public health. And so I just didn't know if you could touch on that really briefly.
What was the question again?
So basically how other fields might intersect with public health. So from MSWs, or if you're in med school or PA, how can you intersect?
Yes, there are quite a few people in our book who have social work degrees and they're doing public health work. So you'll have a social worker whose colleagues have MPHs. And a lot of times that's because you did learn on the job. You started out maybe providing direct care, and then you got involved in a public health program. There are also nursing degrees and social work degrees and doctor degrees like I have that involve public health training. And so you can do both things at once right from the beginning. You can combine your other degree with an MPH degree. Heather, what else would you say about that?
I mean, well, I think those kind of combos are really fantastic, and they're kind of unbeatable, really. Like, I think there's a huge need for public health nurses. That's probably the biggest need right now in health departments anyway. And I would say some combos make more sense in my mind than maybe some others. But generally, yeah, there's social work. People have asked in the chat about mental health and so forth. So there's opportunities for public health social worker. There are a whole range of these kinds of combinations. And I think it's often a really powerful combo to have these different kinds of combinations. Yeah. So feel free to email us, though. I know we don't have, I wish we could answer all of these questions. There's each of these. I'm like, well, I could try to answer these, but then there's so many. So feel free just to email these questions. And I mean, I'll do my best to reply back to as many as possible. And I saw in the chat, there might be a problem with our YouTube link. So I'm glad to send that or send an updated link if I can to those who registered or something like that. But yeah, it's really a pleasure to be here. And I'm so glad that we could have this chat. And I mean, the questions are so awesome. I really wish we could keep going for another couple of hours, but it's really, really good.
Thank you both so much. I really appreciate your time today. I know I learned a lot. I know the audience did as well. So I just want to say, if you are interested in public health and exploring graduate education, we will have grad fairs this fall. This is public health. And so always check out thisispublichealth.org/events specifically to get to the event page and find out more events that we have, grad fairs and other events that we do to help you figure out your path in public health. So thank you all again. Thanks for your time today and have a great rest of your week.